This video is dedicated to all the people who will only trust in their official sources, that don't want to hear anything about, alleged conspiracy theories. So here we go. Let's start off with what the Surgeon General had to say back in March. Seriously, people, stop buying masks. All right? He said it. Stop buying masks. They are not effective in preventing the general public from catching coronavirus. That's what he said. Not my opinion. That is what he said. How about this? This is from this organization. I'm sure you've heard of them. I got to be careful about saying it because YouTube might censor it, because we know that they're just such a great, honest organization. So here's what they have to say about non-pharmaceutical measures for pandemic influenza in non-healthcare settings. All right? And let's just go check out this sentence down here, okay? It says, although mechanistic studies support the potential effect of hand hygiene or face masks, evidence from 14 randomized controlled trials of these measures did not support a substantial effect on transmission of laboratory-confirmed influenza. Let's go take a look at this article a little further, shall we? You can see where it's coming from. And I just want to scroll down. Let's scroll down to the area regarding these things, okay? And exactly what it says. In our systematic review, we identified 10 RCTs that reported estimates of the effectiveness of face masks in reducing laboratory-confirmed influenza virus infections in the community from literature published during 1946 to 2018. In pooled analysis, we found no significant reduction in influenza transmission with the use of face masks. Again, that's exactly what it says. It is not my opinion. That is what the CDC said. It goes on to say, disposable medical masks, also known as surgical masks, these things, you've seen them, are loose-fitting devices that were designed to be worn by medical personnel to protect accidental contamination of patient wounds and to protect the wearer against splashes or sprays of bodily fluids. There is limited evidence for their effectiveness in preventing influenza transmission, either when worn by the infected person for source control or when worn by uninfected persons to reduce exposure. Our systematic review found no significant effect of face masks on transmission of laboratory-confirmed influenza. So now I know some people will say, well, that's different because these tests were for influenza. They tested to see if face masks were effective on influenza, and the coronavirus is much worse. Well, that makes my point even greater, because if the coronavirus or COVID-19 is worse, then that would mean that the face masks, the surgical masks that most people wear, are even less effective, right? If they couldn't prevent influenza, then they certainly can't protect you against COVID-19, which is supposedly worse, right? Let's just use common sense and logic. And look at what it says. Disposable medical masks, also known as surgical masks. Let's be honest. Most people are using those surgical masks. They are loose-fitting devices that were designed to be worn by medical personnel. Folks, they are not, have not ever been, and are not now designed to prevent viruses. They're telling you right there, they do not work. Again, not my opinion. It's right from this organization right here. Let's go to another official source. How about the New England Journal of Medicine? What do they have to say? This was written, I think, back in April. It says, perspective, universal masking in hospitals in the COVID-19 era. All right? And here's what they had to say in the second paragraph. Follow along right here. We know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. It doesn't say we think, we believe. It says we know that wearing a mask outside offers little, if any, protection from the infection. Oh gosh, let's scroll down a little bit further. This is one of my favorite parts. It is also clear that masks serve symbolic roles. Oh, that's nice. I thought they were protecting against infection. Masks are not only tools, they are also talismans that may help increase healthcare workers' perceived sense of safety, well-being, and trust in their hospitals. So, in case you don't know what a talisman is, let's look up the definition from Webster's Dictionary. A talisman is an object held to act as a charm to avert evil and bring good fortune. Something producing apparently magical or miraculous effects. So basically, they're telling you that your mask is about as useful as a lucky rabbit's foot. Oh my God. How about another official source? Let's go to the United States Department of Labor, the Occupational Safety and Health Administration, also known as OSHA. Okay, frequently asked questions. Let's see what they have to say here about what we're talking about. Look at what it says. Cloth face coverings. All right. It says, may be commercially produced or improvised. That is homemade garments, scarves, bandanas. You know, you see these people walking around with these cloths on their face that they made from some random used t-shirt at home. Oh my gosh. They are worn in public over the nose and mouth to contain the wearer's potentially infectious respiratory droplets produced, blah, blah, blah. Here, are not considered personal protective equipment, okay, or PPE. And here we go. Will not protect the wearer against airborne, transmissible infectious agents due to the loose fit and lack of adequate filtration. It's right there. Will not protect the wearer. How about the most common? You know these guys, right? The ones that most people are wearing. Surgical masks, which we already have discussed. They were not made to, stop viruses as put forth by the CDC. Okay? Surgical masks are typically cleared by the U.S. Food and Drug Administration as medical devices. So these are medical devices. Think about that the next time you walk into a supermarket and they tell you that you are required to wear one. Since when can a supermarket manager require you to wear a medical device? Think about that. Though not all these devices look like surgical masks, are actually medical grade clear devices. They are used to protect workers against splashes and sprays. Sound familiar? May also be worn to contain the wearer's respiratory droplets. Here we go. Should be placed on sick individuals to prevent transmission of respiratory infections that spread large droplets. To be worn by sick individuals, not healthy people, sick individuals. And there it is again on the surgical mask. Will not protect the wearer against airborne infectious agents due to loose fit or of seal or inadequate filtration. It's right there. Another official source telling you once again, these things do not work. What else do we have? Well, this is coming from where? FDA.gov. And on page 42 of this document, they talk about the analytical sensitivity of the RRT PCR assays contained in the CDC 2019 novel coronavirus real-time RT-PCR diagnostic panel were determined in limited of detection studies. Since no quantified virus isolates of the 2019 nCoV were available for CDC use at the time the test was developed and the study conducted, assays designed for detection of 2019 nCoV RNA were tested with characterized stocks. Wait a minute. Are you telling me that this virus was never isolated? That seems to be what this document's saying from the FDA. Yes, let's trust our official sources. How about this? What does it say on the box? What does it say on the box of those surgical masks? Look at this. This product is an ear loop mask. This product is not a respirator and will not provide any protection against COVID-19, coronavirus, or other viruses or contaminants. Wearing an ear loop mask does not reduce the risk of contracting any disease or infection. It's on the box, folks. But let's trust our official sources because they know everything. How about another official source? What does this say? You know this organization, right? Their officials urge world leaders to stop using lockdowns as primary virus control method. Yet another official source, people. Just keep listening to them. But let's trust our official sources because they do know everything after all. All right? Let's always trust our official sources. You know, people like this guy. And, you know, he's the guy that always says you got to wear. Oh, wait a minute. What's he doing in that baseball stadium? Well, he's social. No, he's not social distancing. Well, he's wearing a. No, he's not wearing a mask. Well, the person next to him. No, the person next to him's not wearing a mask. Yeah, we can trust this guy. And I'm sure we could probably trust this guy too, because he's another honest guy, you know, because he's all about, you got to, oh, wait a minute. Isn't that the governor of New York? Wait a second. He's the guy always talking about how you can't have parties, you got to social distance, and you got to wear a mask. Right? Okay, folks. Trust your official sources. They know everything. They will never steer you wrong.